Good afternoon, everyone, and thank you for joining us on the news briefing this Wednesday, May 13th. Our mental well-being is a very important part of our overall well-being, and it's something we should talk about more often because data is showing us that more people than we might think are impacted by this. May is Mental Health Awareness Month, and this is a great time to talk about services that are available and reducing stigma around getting those services and the things that people might need. We're very pleased to have staff from our Behavioral Health Bureau here to talk about this. I'd like to welcome Kelly Molton and Liz Perez-Cordero, and we're going to be presenting this information in both English and Spanish for all of our viewers. Ladies, thanks for joining us.
Thank you so much for having us.
So tell us more about Mental Health Awareness Month and what you hear these months that are titled, about things, but it really is a great opportunity to focus on this topic.
Absolutely. And so our goal today is really just to provide some information, but also make sure folks in our community are aware of how to get resources when mental health does come up. And a part of Mental Health Awareness Month is really just about education, and it's about welcoming the conversation about what mental health is and how it impacts folks across our community and beyond. And so as our slides are coming up, we will happily go through all that good stuff. Okay. So again, happy Mental Health Awareness Month, and for behavioral health, we're happy to be here. And next slide. So there might be a little bit of a delay on the slides. I'll go ahead and share if necessary.
Yeah, we lost the slide.
That's okay. I'll pick it up. Let me share just right quick. Okay, here we go. All right, can folks see that slides?
There it is. We got you.
All right, perfect. Here we go. Okay, so some important facts about Mental Health Awareness Month and really mental health in general is that mental health is really an integral part of our physical health. And help is available locally at all levels of mental health, regardless of immigration status or income. We also know that early help, so getting help as soon as things start to become a concern, really leads to the best amount of income or outcomes rather. Seeking help is a sign of strength, not weakness. We want folks to feel good about talking about what they need, because just like we would for physical health, mental health is just the same. And services are culturally and linguistically accessible. So particularly in Monterey County, we have a great deal of resources that are offered in both English and in Spanish, and with indigenous languages as well. So some prevalence around mental health concerns. Mental health concerns are very common in California and across the United States and abroad. Approximately 1 in 5 adults experience a mental health condition each year nationally. So it's not as uncommon as people might think. Locally, we see anxiety, depression, trauma-related stress, substance use challenges, suicide risk, and emotional distress, as well as youth mental health concerns. And we also know that there are social determinants of health that really can impact mental health, such as cost of housing, poverty, discrimination, isolation, and sometimes folks who are not able to access the mental health that they need. So when we think about behavioral health services, they exist across the spectrum, and more than behavioral health is actually at the table. So when you see CDHP, or the California Department of Public Health, after the passing of Prop 1, the state took over a lot of our prevention services. And so they're responsible for, the lower hanging educational sort of services that allow for us to learn more about mental health and risk. This number 2, the managed care plan, those are our partners at CCAH that deal with mild to moderate treatment for our folks. And then you have the Monterey County Behavioral Health Bureau that really serves the severe population, folks that need high-level, long-term mental health care. And then, of course, you have crisis services that are being provided by behavioral health, but are across the spectrum of need. And you can also see that this also includes the private insurance network. So, when we think about our community, we think about what do folks qualify for and who are the providers. So, the county services, we provide the Medi-Cal beneficiaries with specialty mental health services for severe emotional disturbance, etc. We also provide those services for our safety net population. The managed care plan also serves Medi-Cal beneficiaries, but at the mild to moderate level. So the mild to moderate level of distress that are maybe interfering with your life. And then, of course, you have our commercial insurance plans. And those really come for folks that have insurance through their work or have other kinds of private access to insurance and medical care. The providers of each of those services. So the county is obviously, it's Monterey County Behavioral Health and our contracted agencies. And then other kinds of managed care network agencies that pick up our our mild to moderate. And then, of course, our commercial plans are really for those who are specifically designated for those programs. And the access is, for our county services, it's 24/7. We have a 24/7 access line that allows for individuals seeking behavioral health services to get an appointment. And then we have various county level clinics and referrals. Our managed care plan, you access that through either behavioral health or your primary care. And then for commercial insurance providers, it's really, making that phone call to your carrier. So again, here's your commercial insurance, folks. Usually we will encourage folks to call their member insurance, either the phone number on their insurance card or if they get something else from their employer. Ask about mental health coverage. Most plans these days have mental health coverage. And then ask for a list of providers in your area because we want folks to be able to get services locally. And then you can be as specific as you like in terms of asking for what it is you need. Our managed care plan, or the CCAH, known as Central California Alliance for Health. Again, these are for our moderate or our mild to moderate folks. So you can get mental health evaluations, you can get psychological testing, outpatient services, lab services, and then psychiatric consultation if you need medications or you'd like to talk to a psychiatrist. And again, these are also for our Medi-Cal members, and you're welcome to call the member service at 800-700-3874. Our Behavioral Health Bureau, our access line is 1-888-258-6029. And again, our focus is really on our Medi-Cal members. And so we support individuals and groups and families as needed. For CCAH, really, we're calling CCAH if you're experiencing things like grief and loss, difficulty with recent changes, such as, divorce or job loss or marital problems. If you're feeling isolated or lonely, experiencing depression or anxiety, maybe you've begun using substances more than you like, but it's not taken too hard or too significantly for you yet. If you're experiencing obsession with food or maybe an eating disorder concern, maybe you're a new mom and experiencing some anxiety or depression either before, during, or after your birth. And you're under 21 years of age and struggling with language or speech, concerns that you might have issues such as autism. So with behavioral health, again, we're serving the severe population. And so really what we're looking for is major problems at home, work, or school. Like your mental health concerns are impacting your daily life significantly. Maybe you're dealing with significant isolation and withdrawal, recent hospitalizations, frequent emergency room visits, serious substance use concerns. Maybe you're having crisis issues and having contacts with the law, current thoughts of suicide or plan to end one's life, severe eating disorders where likely you're putting your physical health in danger. And then if you're a pregnant or a new mom having really serious thoughts about hurting yourself or your child potentially. This is one of our standard forms that we give out to folks that we come in contact with. So these are all of our clinics, as well as our QR code. You can see that we have our community crisis line number that's on 24/7, as well as how to get a hold of the psychiatric team at Natividad. And we have both Seneca and our 988 numbers on here. So this is where you go for help. Some additional numbers, again, the access line that we've talked about, the community crisis line in Monterey. So this is 24/7, and this is also our non-911 access to mobile crisis if individuals need it. Our 24/7 Seneca support line, their specialty is young people 0 to 21, particularly those who might have system involvement. And then, of course, 988 and our crisis lifeline. There's some additional resources for kids and families and then young adults. And then Rainbow Connections, this is specifically for our LGBTQ plus and allies. And then, of course, NAMI. And NAMI is a wonderful partner here in Monterey County. Provide a large number of services in both English and Spanish, and they're led by volunteers, so individuals who have family members and loved ones that have mental health concerns. They offer lots of groups and ways to connect to provide support. And you can either call 831-422-6264 or email info@namimonterey.org. Okay, I will now pass this off to my colleague, Dr. Liz Perez.
Hello. Hola, buenas tardes a todos. Yo soy la doctora Liz Pérez de los Servicios de Salud Conductual del Condado de Monterrey. Voy entonces a dar la presentación para hablar un poco de salud mental y salud conductual. Esta tarde vamos a hablar de todos los servicios que están disponibles a través del condado y a proveer un poco de información para entender un poquito mejor las dificultades de salud mental. Next slide. Unos datos importantes sobre la salud mental. La salud mental es tan importante como la salud física. Tenemos que cuidarlo de la misma manera. Hay ayuda disponible localmente sin importar los ingresos o el estado migratorio. Tenemos, y vamos a dialogar un poquito más al frente, cuáles son esos servicios. Buscar ayuda tempranamente cuando empezamos a sentirnos mal o a sentir que tenemos dificultades, da mejores resultados. Buscamos ayuda. Buscando ayuda es una señal de fortaleza, no es una señal de debilidad. Aquellas personas que decimos necesitamos un poco de apoyo, tenemos mejores resultados y mejor calidad de vida. Los servicios que están disponibles son enfocados culturalmente y lingüísticamente. Next slide, please. ¿Cómo son los problemas y las condiciones de salud mental? Son muy comunes aquí en California, en todos los Estados Unidos, en realidad en todos lados donde vemos seres humanos. Aproximadamente cada uno de 5 adultos experimenta una condición de salud mental cada año. Esto no significa que sea una condición severa, pero muchos de nosotros experimentamos síntomas de estrés y preocupaciones que nos causan cambios físicos o mentales que necesitamos ayuda. En el condado de Monterrey, las preocupaciones más comunes incluyen ansiedad, depresión, estrés relacionados con traumas, desafíos con el uso de sustancias, riesgo de suicidio y angustia emocional, problemas de salud mental en la juventud. Factores como el costo de vivienda, la pobreza, la discriminación, el aislamiento y el acceso al cuidado médico afectan nuestro bienestar. Next slide. Los servicios de salud mental se ofrecen en un continuo. Los servicios de prevención han cambiado del Departamento de Salud Mental al Departamento de Salud Pública de California. Esto es después que se pasó la Proposición 1 para el plan Y entonces estos servicios de prevención son los servicios que se enfocan más en actividades de educación o actividades generales del bienestar, lo que nos ayuda a, a prever que tengamos más dificultades en el futuro. Tenemos el plan del medical, el MSP por las siglas en inglés, que provee tratamiento y recursos para síntomas leves y moderados. Los servicios para tratamiento severo se ofrecen a través de los servicios directos del condado o por los programas que tenemos contratados en el condado. Y entonces, a través de ese continuo, se ofrecen servicios de crisis para todos. Todos nuestros servicios mantienen colaboraciones porque a veces tenemos que pasar de un nivel a otro. Y los servicios también están disponibles para aquellas personas que tienen seguros o aseguranzas privadas. Next slide, please. ¿Quiénes son los clientes de cada uno de estos niveles? Para los servicios del condado, tratamos nosotros las personas que tienen medical o que no tienen aseguranza, somos la red de seguridad del condado. Pero para personas que tienen síntomas severos, los empleados del Departamento de Salud Mental son esas personas que ofrecen los servicios y se accesan llamando a la línea que funciona las 24 horas con los números que le vamos a proveer en un momentito. El tratamiento por los servicios del plan medical en el condado de nosotros es el CCAH, la CCAH, por sus siglas en inglés. Ellos coordinan los tratamientos y los servicios para las condiciones que son leves y moderadas. Los proveedores de salud conductual en la red del plan de medical son personas contratadas por ellos y están en la comunidad. Usualmente, las personas accesan esos servicios por referido por su médico primario o llamando a la red y al número que le vamos a ofrecer ya mismo. Y también están los servicios de las aseguranzas o los servicios comerciales o privados. Usamos el nombre las dos veces, pero es lo mismo. Esos son los seguros que se proveen a través de los empleos o uno, buscándolos separadamente. Los proveedores son contratados por la red del plan comercial y usualmente esos referidos vienen por su médico primario o por el portal de la red de los miembros. Next slide, please. Para el seguro comercial, si quiere accesar servicios, debe llamar al número de su tarjeta, preguntar por su cobertura y los servicios que tienen disponible, pedir una lista de los proveedores en su área y puede preguntar por servicios específicos, por ejemplo, si quiere psicólogos, terapeutas, consejeros, si quiere alguien que se especialice en niños, adultos o familias, o si quiere alguien que tenga una especialización en tratamiento de trauma o conflictos de pareja. Next slide, please. Para el plan del medical, los servicios que son de leves a moderados se llama a la Alianza de California. Entonces, ellos proveen evaluación y tratamiento de salud mental, incluyendo psicoterapia individual, grupal y familiar. Proveen pruebas psicológicas y ayudan a coordinar pruebas neuropsicológicas cuando están clínicamente indicadas. Los servicios ambulatorios para el monitoreo de la terapia con medicamentos ofrecen consulta y tratamiento psiquiátrico y también coordinan los servicios ambulatorios del laboratorio y otros servicios médicos generales. Next slide, please. Si quiere accesar los servicios del CCAH para el plan del medical, debe llamar al número 800-700-3874 y ellos le ayudan a coordinar esos servicios con los proveedores de la comunidad. Next slide, please. Nosotros, la División de Salud Conductual del Condado de Monterey, también tenemos servicios para los problemas de salud mental severos. Tenemos el acceso de las 24/7 llamando al número 888-258-6029. Trabajamos con los miembros del medical o aquellas personas que no tienen acceso a seguro médico. Trabajamos, como dijo, los síntomas de salud mental severos. Ofrecemos terapia, manejo de caso, manejo de cuidado, psiquiatría y referidos a organizaciones de la comunidad. Muchos de nuestros servidores están entrenados para trabajar con problemas de salud mental especializadamente. Next slide, please. Entonces, ¿cómo decidir a quién va a llamar? Si quiere llamar al plan de salud mental de la CCH para los síntomas severos, aquí hay una lista que le vamos a dar una información para saber si tiene problemas usted o un miembro de su familia que esté pasando o provocando estrés. Por ejemplo, duelo y pérdida, dificultad con un cambio de vida reciente como divorcio, pérdida de trabajo, problemas maritales, problemas en la escuela o cambios familiares. Si se siente ansioso o o está aislado o con pocas relaciones o poco apoyo. Si tiene depresión o ansiedad que le esté limitando a hacer cosas que antes hacía. Si tiene problemas con el consumo de alcohol o de sustancia que le están causando angustia o dificultades en sus relaciones. Obsesión con comida o con el peso corporal que le provoca angustia o si tiene cambios físicos a resultado de esos cambios de cómo comer y si está velando mucho el peso. Si es una madre embarazada o primeriza o secundaria, porque realmente cuando hay cambios, como somos nuestros cambios, nuestro cuerpo cambia en cualquier momento. Si es una madre, ha estado embarazada, y tiene pensamientos ansiosos o depresión, también puede llamar al plan. Y si es una persona joven, menos de 21 años, que tenga dificultades con el lenguaje o hablar o evita el contacto visual, problemas con amistades, compañeros o otros síntomas que sean más síntomas relacionados al problemas de autismo, pues llame al plan del condado del CCAH. Next slide, please. Para accesar los servicios de salud mental del condado, tenemos clínicas en muchas de nuestras áreas, clínicas en Salina, Marina, King City, Soledad, en Salinas, en la calle Pearl Street, y tenemos contactos adicionales de apoyo que le vamos a hablar en un momentito. Next slide, please. Para los números de ayuda, la línea de acceso del condado, como mencioné anteriormente, es la del 888-258-6029. Entonces, cuando llame, se coordina una cita para decidir cuál va a ser el próximo paso y coordinar más servicios. La línea de comunitaria de crisis, si tiene problemas en el momento o está necesitando intervención, puede llamar a la línea de crisis para tener ayuda telefónica, y si se necesita más ayuda, ellos mandan o envían un equipo de intervención móvil. La línea de apoyo de 24 horas de Seneca, esa es especializada para individuos menores de 21 años, pues, o para nuestros niños y adolescentes jóvenes. También está la línea de ayuda de 24 horas, que es especializada para aquellos que han estado en cuidado de crianza temporal o el foster care. Antes o actualmente tienen una línea especializada para ayudar. Y también el número 988, que es la línea de crisis y prevención del suicidio. Este número es el número que aparece en todas las tarjetitas de identificación para los estudiantes en el condado de Monterey. Y ellos ayudan a coordinar los servicios de crisis que se necesitan. Next slide, please. Vamos a ofrecerle algunos recursos adicionales. El estado de California ha creado dos tipos de servicios dependiendo de la edad que son gratuitos y se pueden accesar virtualmente por el teléfono. Son unas aplicaciones que les establecen contactos con consejeros o herramientas para lidiar con estrés. El Soluna es para personas jóvenes de los 13 a los 25 años y el Bright Life Kids, que es el que está a la derecha, el naranjadito, son para los niños de 0 a 12 años y todos esos servicios son gratuitos. Le piden un poquito de información para saber coordinar su área, pero después de eso todos los servicios están accesibles por su teléfono. Next slide, please. En el condado de Monterrey tenemos servicios especializados en muchas de las escuelas y en nuestras clínicas, y esto está accesible para todos, y son aquellos servicios especializados para la población que se identifica diferentemente, para aquellos que tienen un género variable, los LGBTQ, como le decimos en las siglas en inglés, toda la población. Tenemos distintos grupos de ayuda para los estudiantes, para padres, para conocer un poquito más del tema, y pueden accesarlos a través de la información que está aquí o en el internet. La próxima, por favor. Next slide. Y vamos a terminar con unos recursos de grupos de apoyo de NAMI en el condado de Monterrey. Estos grupos ofrecen en inglés y en español y están dirigidos por voluntarios que se han entrenado. No es un requisito vivir en el condado para accesar estos grupos de apoyo. Puede obtener más información de los distintos grupos como apoyo familiar, grupos de conexión y recuperación, grupos de conexión y apoyo para la diversidad y grupos de apoyo para los adultos jóvenes. Entonces, pueden llamar al 831-422-6262 para preguntar sobre los grupos de apoyo de NAMI. Next slide, please. And that is it. Esto termina la presentación formal que teníamos para ustedes esta mañana.
Ladies, thank you so much for walking through this 2 times. One thing that really jumps out at me from looking at this presentation is that the resource pages are getting bigger. And I'm thinking over the last 3 to 5 years, there used to be just one hotline or one group that used to be able to provide services. Now you have so much more. What do you think has driven this? And I say it's a great thing. We seem to be paying a lot more attention to people's needs with this increase in services and options for people.
I think that there's a lot of things that have changed. As a general community, as an understanding, as like public health is really starting to destigmatize conversations around health, around getting supports. So there's a lot of effort put into creating opportunities for access. For us on the end of coordinating all of that, we've provided a lot of numbers, and the reality is that all those numbers in some shape or form work together to have a community response across an array of need and age groups. So that has changed. There's also some significant changes in rules and legislation that has focused and mandated certain access availability that wasn't there. For example, like kids in the schools and having to secure and include numbers of supports for all of our youth so that they have them with them all of the time, regardless of what's coming up. So that has been great. Kelly, anything else to add?
Just that really our focus is about, getting in as quickly as possible, because the outcome reality is that the sooner we get someone mental health help, the better off they are. And so we really try to make it as easy as we can for the community to ask for help.
Well, and that's where I'm seeing the word prevention come in on this. And I mean, we all know about prevention with our regular medical care. We go in for well visits or we have a checkup. There's no reason why you can't have a mental health checkup either. And that's really kind of opened the door to just normalizing people looking at their mental well-being. Are you seeing the same trend?
Yes, people are much more comfortable these days talking about their needs, whether it's because, the social media has opened up a bit, or if because, they're willing to talk to their primary care doctor about, hey, I really don't feel very good, or I don't understand why I don't have energy to do this thing, or this thing that I used to love to do, I don't love to do it anymore. And so really it's the work that's been done across California and nationally about destigmatizing, but then also offering the opportunity to to use an anonymous helpline, or to, provide resources to counties to do that kind of work.
And just also to talk about the number of people who are accessing, I found a number about the number of people who get services from your department. It was 13,000. This is not just a few people having, a bad day.
That's
And
correct.
and that number really speaks to the reason why we have all this outreach and why we're here talking about it today.
Absolutely.
Ladies, thank you so much for walking through this 2 times. Really great information, and those numbers and that access information is fantastic, and appreciate it.
Thank you so much for having us.
Gracias.
So we're going to stay on the topic of behavioral health. The end of an important public comment period is fast approaching. The county has drafted a 3-year plan for Behavioral Health Services Act, which is state funds, which support programs. The public comment period time on this is coming up, and we really want to get the community involved in reading this. We're very pleased to have Fabricio Chombo, Assistant Bureau Chief of our Behavioral Health Bureau, here to talk about the importance of making that comment. Hi, Fabricio. Thanks very much for being here and for sharing this information in both English and Spanish.
Of course, yeah, thank you. And thank you for having me here. So I have some slides that I'm gonna go through. So let me share my screen. And okay, here we go. So good afternoon again. And as noted, my name is Fabricio Chombo. I am the Assistant Bureau Chief with the Behavioral Health Bureau for the Monterey County Health Department. And first, I want to express my gratitude for having us back again. We presented this back on April 15th, just to let the community know that the integrated plan public period was opened. And so back on April 15th, we provided an overview of the county's transition from the Mental Health Services Act to the Behavioral Health Services Act. And we also introduced the county's draft integrated plan idea. And so just to give you a little overview and a reminder, so BHSA, Behavioral Health Services Act, was established through Proposition 1, which was approved by California voters by a very, very narrow margin of approximately 0.4%, or 26,223 votes statewide. And so Proposition 1 included 2 legislatures. It was Senate Bill 326 and Assembly Bill 531. SB 336 essentially restructured the Mental Health Services Act, now the Behavioral Health Services Act, and it essentially updated how counties plan, fund, and deliver behavioral health services, with a very strong focus on accountability, performance, and system alignment. While AB 531 established a new behavioral health infrastructure funding mechanism, to include investments in treatment beds, housing, and supporting facilities to expand system capacity across California. So together, the two measures form the California's updated behavioral health system framework designed to strengthen coordination, expand capacity, and improve access to care across the full continuum of services. The transition is not simply the name change, it also represents a significant system shift across California as all 58 counties continue to navigate evolving state requirements while responding to ongoing community health needs. So one of the components of Prop 1 or BHSA is the BHSA integrated plan. And this is a required component of the act that serves as all counties' framework for outlining priorities, funding direction, and implementation approach under this new statewide system. Our approach has been intentional and measured. We have a focus on maintaining continuity of care, supporting long-term system stability, and aligning implementation with evolving state requirements in a way that avoids unnecessary disruption to services for the individuals and families who rely on them. So as such, we released our draft integrated plan for public comment back on April 3rd, and it remains open up until next Monday at 5 p.m. And so if anybody in the community wishes to make a comment on our draft integrated plan, this screen has the QR codes for them to access our integrated plan and our integrated plan budget. And they may review and submit comments via email at bhsa@countyofmonterey.gov, or they can send them via regular mail to 1270 Natividad Road, Salinas, California, with attention to BHSA. I will also post a link to our integrated plan in the chat. See if I can do this. And so if you click on that link, then you can scroll down to Behavioral Health Services Act Integrated Plan, click the arrow, and then expand to the 3-year integrated plan and budget. One last thing I want to add is that there will be a public hearing at our Behavioral Health Commission's monthly meeting on May 28th, 2026, where staff will be presenting the integrated plan along with all the public comments that we hear from the community for review and approval of the Behavioral Health Commission. The meeting will be held in person at our Marina Clinic located at 299 12th Street in Marina. That's May 28th at 5:30, and it will also be held via Zoom. Following that meeting, we will be presenting the integrated plan and comments to the the Monterey County Board of Supervisors at their June 16th, 2026 meeting. Again, those meetings are also held in person at the board chambers at 168 West Alisal and via Zoom. Lastly, we just want to encourage community members, providers, stakeholders to review the plan, submit any feedback that they may have, as community input is a key part of ensuring the plan reflects both state requirements and the needs and lived experiences of our residents. And the BHSA website, sorry, I'm reading a comment. BHSA website says the deadline is 5:30. It's 5 p.m. It should be 5 p.m., but I'll double check, Kara. Apologies for that. Okay, so with that, we'll transition to the Spanish presentation. Buenas tardes a todos, mi nombre es Fabricio Chombo y soy el subdirector de la Oficina de Salud Conductual del Departamento de Salud del Condado de Monterey. Antes que nada, quiero dar las gracias por la oportunidad de regresar después de la presentación que hicimos el 15 de abril. Hace un mes, el 15 de abril, nuestro departamento presentó un resumen de la transición de la Ley de Servicios de Salud Mental, la MHSA, a la Ley de Servicios de Salud Conductual o BHSA. Y también presentamos una vista alta de la versión preliminar de nuestro plan integrado de la BHSA del condado. Como recordatorio a todos, la BHSA fue creada a través de la Proposición 1, la cual fue aprobada por los votantes de California por una diferencia muy pequeña de aproximadamente 0.4% o 26,223 votos en todo el estado. La Proposición 1 incluía dos leyes importantes. Primero era el proyecto de la Ley del Senado 326 o SB 326 y el segundo, el proyecto de la Ley de Asamblea 531 o AB 531. El primero, el SB 326, reorganiza la Ley de Servicios de Salud Mental, ahora lo que se llama la Ley de Servicios de Salud Conductual, y cambia la forma en que los condados planifican y financian y entregan servicios de salud mental y uso de sustancias con un enfoque más grande en responsabilidad, resultados y coordinación del sistema. La otra ley, la AB 531, crea fondos para infraestructura de la salud conductual, incluyendo inversiones en camas de tratamiento, vivienda y otros apoyos para fortalecer la capacidad del sistema en todo el estado. Juntos, estos cambios forman el nuevo sistema de salud conductual de California con el objetivo de mejorar la coordinación, aumentar la capacidad y ampliar el acceso a los servicios. El cambio no solo es un cambio de nombre, es un cambio importante en todo el sistema en California. Mientras todos los condados seguimos adaptándonos a nuevas reglas del estado y a las necesidades de la comunidad. La versión preliminar del plan integrado de la BHSA es un requisito de esta ley y sirve como guía del condado para establecer prioridades y financiamiento y cómo se implementa el sistema. El condado de Monterey está tomando un enfoque cuidadoso y paso a paso. El objetivo es mantener la continuidad de los servicios, asegurar estabilidad a largo plazo y seguir las reglas del estado, evitando interrupciones en la atención para las personas y familias que dependen de estos servicios. La versión preliminar del plan integrado de la ley BHSA ha estado abierto desde el 3 de abril y cierra para comentarios públicos el 18 de mayo. Para hacer comentarios, los pueden hacer de dos maneras. Pueden enviarlos por correo electrónico al bhsa@countyofmonterrey.gov o por correo regular, por correo postal al 1270 Natividad Road, Salinas, California, con atención BHSA. El plan y el presupuesto están disponibles en el enlace que voy a poner ahorita en el chat. Y cuando accedan aquí, simplemente pueden deslizarse hacia abajo hasta donde está encuentran donde diga Ley de Servicios de Salud Conductual, hacen clic en la flecha para desplegar el plan y el presupuesto de 3 años. Una cosa que queremos añadir es que habrá una audiencia pública en la reunión mensual de la Comisión de la Salud Conductual el 28 de mayo de 2026, donde nuestro personal presentará la versión preliminar del plan integrado junto con todos los comentarios que juntemos de aquí al 18 de mayo para la revisión y aprobación de la comisión. La reunión se llevará a cabo en persona en nuestra clínica de Marina, ubicada en el 299, calle 12 en Marina, a las 5:30 de la tarde y también estará disponible por Zoom. Después de esta audiencia, el plan será presentado a la Junta de Supervisores del Condado en su reunión del 16 de junio del 2026. Estas reuniones también se llevan a cabo en las cámaras de la Junta de la Mesa de Supervisores, localizadas en el 168 West Alisal Street en Salinas, y también están disponibles por Zoom. Y últimamente, solo queremos invitar a todos los miembros de la comunidad, proveedores y socios a revisar el plan y compartir sus comentarios durante este periodo. La participación de la comunidad es una parte importante para asegurar que el plan refleje las reglas del estado y también las necesidades y experiencias reales de los residentes del condado de Monterey. Aquí en la pantalla también, si quieren, los códigos QR El de la izquierda los va a llevar directamente al plan integrado, el de la derecha los llevará directamente a nuestro presupuesto. Muchas gracias a todos y esta es mi presentación. Thank you. This concludes our presentation.
Thank you so much, Fabricio. And you did mention something during the presentation about the timing for the submissions, 5 or 5:30. And I just wanted to find out, are you guys going to just kind of take a look at that and either fix the website or update your slide? And we'll share those after the briefing for everyone.
Yeah, I do see. So the date that Kara was referring, I believe that is, I'm on the website right now. And so it says that we invite the public to attend our Behavioral Health Commission on May 28th at 5:30. So that's the meeting that we'll be having. But public comments are going to be accepted until May 18th at 5 p.m.
Thank you. You're going to have to pick a different time for those meetings or they're going to get...
I know, they're too close, yeah.
Too close. Thank you so much for walking through this again, and I appreciate you coming back. One thing I'd like to ask you, sometimes when people access these reports, they want to do their part, as a community member, and they access these reports, they're a little intimidating because they are a report. What do you want people to look for as they are reading this draft?
Yeah, so unfortunately, the state gave us very little flexibility on how we could present this information. So for context, our MHSA 3-year plan allowed us to include a lot of information on the type of services that we provided and information about our population and all these things. And that changed with this requirement for the integrated plan. And it's essentially a state template that we have to follow. So it's not very reader friendly, unfortunately. I mean, there's just a lot of information in there on where the funding is going, on some of the services. So just, I would ask the community, obviously every feedback is important, but yeah, focus on whatever information that's concerning to them in our community.
All right, and don't be intimidated by it being a report, because I think once you get into it, you'll find the information that you need, and you'll be able to then comment appropriately. Fabricio, thank you so much for walking us through this, and good luck. And I really hope that we get a lot of comments in that will really help you as you look towards adoption of this.
We too hope that. And if anybody opens the document and have any questions, they can also email us to that bhsa@countyofmonterey.gov. And if they need to speak to somebody, we can have somebody call them back. But we want to provide as much information as possible. So thank you.
Thank you. And thanks everyone for joining us on the news briefing this week. Our next briefing is next week. We'll see you then.